Well, I haven't liked my nose for a while, and I was trying to find a good surgeon, but I couldn't really find anyone that I loved all their work until I found Dr. Kotler. I saw other plastic surgeons' websites, but I never liked all of their work. Dr. Kotler was the only one that I pretty much liked every single one of his nose jobs. They all look natural, small, pretty almost perfect. I haven't really liked my nose. We're Middle Eastern, so I have the hump up here. I just felt uncomfortable, and I always thought people were staring at me. I always worried like, oh, there's people looking at me from the side, and I never really wore my hair up. I wanted to get rid of this little hump and then shorten it from here just a little bit back. Yeah, people who told me they've had nose jobs before say they can't breathe, it's all stuffy. But with Dr. Kotler's nose airway, hopefully I will be able to.
What did you think of Dr. Kotler?
Oh, he's very nice. All his staff's nice. You come in, he makes you feel very welcome and comfortable. I feel very confident in Dr. Kotler that the outcome will be good and that all his staff will take care of me and I'll be okay.
So it's been 5 days, right? And you feel good. You got a little protector on.
Yeah.
How's your breathing?
It's good.
So what we're going to do is we're going to take off the little protector. Won't hurt. I'm just going to use a little Q-tip and peel it off. Wow, okay, good. But right now we're going to have fun because I'm going to give Adriana the mirrors and she's going to look at her new nose. As you can tell, tip is narrower, bridge is down, and remember how your nose was too close to your lip and when you smiled it would come down? Doesn't happen anymore. Let me give you the second mirror so you can get a good look at the profile. Good. You like? Those aren't tears of unhappiness, right? Those
No.
Tears. Those are tears of joy.
Swollen, but wow.
It is swollen. That's correct. But remember, it's only 5 days since surgery. Very quickly, the swelling's going to go down. So let me ask you a question. Do you think the experience was more of a burden or less of a burden than you thought it would be? How would you rate it compared to what you had heard or perhaps what you thought it was going to be like?
It was an amazing experience. It was a lot less painful than I thought it was going to be. I thought it was going to be really bad, but it was really easy. Anesthesia, I woke up fine. I wasn't really groggy for more than 5-10 minutes.
Right.
I had no pain after. I was okay. Yeah.
Good. So it was a pretty good run. One of the things that often is not appreciated is the role of the anesthesiologist and the nursing staff. They're kind of behind the scenes, but it's very important. We can't do great work without great anesthesia. And as Adriana said, when she woke up, she felt fine. There's no nausea or vomiting, very quick recovery, totally different from the old days because we have better anesthetic drugs today. Not unusual for a patient to leave the surgery center in less than an hour after we roll the patient into the recovery room.
But even my mom was saying that nurses were surprised when I woke up. I had very minimal bruising. And I had my bruising medication. And I just ate a lot of pineapples to minimize the bruising.
The anti-bruising medication that we did for Adriana, very helpful. Cuts down the bruising, and during the operation, again, you wouldn't know this, we give intravenous doses of medication to reduce swelling and bruising. And you remember the little pills you took the night of the surgery? You might not remember that, but then the next morning, anti-swelling pills, anti-bruising pills. So we're using the best of medical science, the best drugs we have, to just make everything go along very quickly and safely so patients feel comfortable. And in the old days, we didn't have them, and patients had a lot more swelling and bruising.